This short presentation introduces the Health and Social Care Professional to Scotland's National Incident Reporting and Investigation Centre, IRIC. It informs staff working within NHS boards and local authorities of their responsibilities and the importance of reporting adverse incidents involving medical devices, estates, facilities, social care equipment and PPE to IRIC. Contents. The presentation will cover the following. What is IRIC? Why report your adverse incidents to IRIC? What is an adverse incident? What should I report to IRIC? How do I report to IRIC? And what does IRIC do with your incident report? What is IRIC? IRIC is Scotland's Incident Reporting and Investigation Centre. IRIC provides specialist safety and risk management support to Scotland's NHS boards and local authorities. IRIC manages and operates the following at national level: the Adverse Incident Reporting and Investigation System, the Safety Alert System, and the Incidents and Alerts Safety Officer Network. IRIC aims to improve the safety of equipment and facilities in Scotland's health and social care sectors. Why report your adverse incidents to IRIC? The Chief Executive Letter, Cell 43, sets out the responsibilities of Chief Executives in NHS boards and local authorities for ensuring that procedures exist for the reporting of adverse incidents. There must also be systems in place for the dissemination of safety advice and for ensuring risk control measures relating to health, social care, estates and facilities equipment are in place. IRIC has a specific remit from the Scottish Government under Cell 43 to operate a national adverse incident reporting and investigation system. IRIC investigates incidents to establish the root causes to prevent or reduce any identified risks. Learning from adverse incidents reduces the likelihood of reoccurrence and ensures that NHS boards and local authorities deliver care services safely across Scotland. Everyone has a responsibility to report adverse incidents involving equipment, firstly to their employer's local risk management system, and secondly to IRIC's national system. Your adverse incident report counts and helps to improve patient safety. What is an adverse incident? An adverse incident is an event that causes or has the potential to cause unexpected or unwanted effects involving the health and safety of patients, users, and other persons, such as staff, contractors, and visitors. An adverse incident is an actual event, but also includes near misses and safety concerns. Such occurrences are usually unexpected or could not have been anticipated. Risk control measures were either missing, inadequate, or unused. A near miss is an incident where no one has been harmed. These should also be reported. By reporting near misses, a failure trend could be picked up and dealt with before other organisations are affected or anyone is harmed. Reviewing near misses regularly helps promote learning. You might identify a safety concern with equipment before an adverse incident or near miss has occurred. Please report it to IRIC. You don't have to wait for an incident to happen. What are the possible causes of an adverse incident? Equipment-related adverse incidents can be caused by a wide range of contributory factors. Issues can arise from manufacturing and include design flaws, misassembly, material degradation, or poor instructions for use. Adverse incidents can also arise from the provision and use of equipment, such as incorrect use, failure to follow instructions for use, inadequate maintenance, damage during transportation, or failure to plan for replacement. What should you report to IRIC? You should report adverse incidents involving the following types of equipment: medical devices, in vitro diagnostic medical devices, estates and facilities equipment, social care equipment, and personal protective equipment. Examples of equipment failures. Examples of medical device failures may include a skin stapler may have failed to form staples or close a wound, or a defibrillator may have failed to deliver a shock, undermining resuscitation. Examples of estates and facilities equipment failures include Pipe medical gas may have incorrect NSIT fittings, or an anti-ligature shower curtain rail fails to collapse. Examples of social care equipment failures may include a bathboard collapsed whilst in use, causing injury to the service user, or a patient traps their leg within a shower stall. How do I report to IRIC? Contact IRIC at nss.iric@nhs.scot to request an account which will enable you to report your adverse incidents to us. IRIC will send you login details, username and password with a link to our reporting web form. If your organisation has a firewall that won't allow access to our reporting web form, then we can provide an alternative form for you to use. We will need your contact details, the make and model of the equipment implicated in the incident, serial number or lot number if known, and a short description of what happened during the equipment's use. If possible, please quarantine the implicated equipment securely and safely so that it can be returned to the manufacturer for their investigations. What does IRIC do with your incident report? Your incident report is referred to our in-house team of product specialists working within Health Facilities Scotland and NHS Scotland Assure. We review, risk assess, triage and trend every incident report sent to us. Every incident report becomes a live data point on IRIC's national trending system and is actively monitored to detect emerging adverse trends involving equipment and facilities within Scotland. Trending analysis is performed on the following data fields: equipment category, suspected problem, health impact, manufacturer and model. We may wait to see if your incident report is part of a wider trend, or alternatively escalate your report for immediate investigation with the manufacturer. Your incident report could lead to changes by the manufacturer or the publication of a safety alert. Thank you for taking the time to listen to this presentation. Please report your adverse incidents to us. Your adverse incident report counts and helps to improve patient safety. Thank you.